Hi, I'm Emma and this is Ashleigh and Lisa, and we're here today to raise awareness about inflammatory breast cancer. So, over to Ashleigh.
As Emma said, my name's Ashleigh. I'm here representing the Inflammatory Breast Cancer Network UK, which is a charity associated with inflammatory breast cancer, and talk a bit about the cancer and about my story as well.
Morning, my name's Lisa and I'm here to support these two lovely ladies. They're just amazing, and my hubby, Paul, is going to be the one that set himself up for the rest of the year doing lots of challenges to raise so much awareness and, more importantly, funds to get the vital research that you guys need. So yeah, we're just going to have a chat this morning about
Absolutely.
IBC.
Yeah, definitely. So Ashleigh, you tell us a bit about you and why you're supporting such an amazing charity. So tell us a bit about IBC.
So IBC is breast cancer. It's a rare type of breast cancer. And it's a type that doesn't necessarily present with a lump. And there's usually they think about 1 to 2% of all breast cancer is inflammatory. And how it presents is that it comes up as skin changes usually and swelling. And the classical sign, which they say is a purred orange, hence why I'm in orange today. So, what that means, if you think of a skin of an orange, it's got little pits in it, and that's what the skin looks like when you've got this type of breast cancer, because it swells up, it thickens, and you can get a little bit of skin change as well, so it might look a bit pinkish or reddish. And it can look a bit like mastitis, which some women do get.
Right, yeah.
Gosh.
Interesting.
So that's like, I've never heard of it before until obviously Lisa's husband were all friends, and you said you were going to do this amazing thing for the charity, and then now I'm like, what is this? So how rare is it?
It is rare. So breast cancer is one of the commonest cancers that you can get, and it's obviously more common in women than men. But in the UK, I think there's about 55,000 women get diagnosed every year, of which about 400 are men. So men need to be aware of it as well. Yeah. Of which, as I said, about 1%, 2% they think in the UK have inflammatory breast cancer. But it's just a bit different, as I said, how it presents and how it looks. I don't think all women are aware of that, which is why I want to try and raise awareness of it, because they think, like, oh, I'm checking my boobs, but are they checking it right? And oh, I'm just looking for a lump, when actually it could be something else you need to keep an eye on.
I think that's really important, isn't it, for the awareness to be, it's not always just a lump, because most people would say, oh, I've checked, I'm doing everything that I've been told to do, armpits, everything, and there's no lump there, I'm absolutely fine. But if you've got a bit of an inflammation, you think, yeah, it's nothing, it'll go. So yeah, totally, wouldn't have known. Yeah.
I feel quite embarrassed actually, because I'm 44, nearly 45, and yeah, I check, but I don't know what else to look for other than a lump. So to me, I'm not doing the right thing for me, looking after myself as a woman. So this is why it's amazing that you guys are doing what you're doing, because we can raise awareness for people and we can get this out there, and actually checking your body is so important, but actually knowing what to look for. Like, I didn't know about the orange, the skin could change, I didn't even know that until today. So I wear glasses, I'm wearing contacts today, but I don't wear contacts when I'm in the shower, and generally that's probably the best place to sort of have a feel, warm soapy hands, but also look in the mirror and put your arms up above your head and have a good look underneath, because how mine presented was actually that swelling underneath. Really?
So I think I didn't notice it because I'm blind without glasses. So when you could get him changed in the morning, you're there rushing, getting your clothes on and stuff, and you just don't. Who spends the time actually looking at the boobs? Everyone's boobs are a bit different, but the important thing is knowing what's normal for you, and it will change at different times of the month with your hormones and things, but it's knowing what are normal changes for you. What does your skin look like? Do you have one boob that's slightly bigger than the other? Do you have a nipple that goes in? Is that normal for you? If that's changing, then actually you do need to probably see your doctor and get just things checked out.
Wow.
And can I just ask, so I know it's probably not a lot of people want to say it, but a lot of girls have implants.
Yes.
And how does having an impact how does having an impact Sunday morning. Easy said. How does having an implant impact how you'd be able to find inflammatory breast cancer, obviously, because that's maybe hard for some women.
Yeah, one of the girls asked that actually in the office, like, how do you know what to look for if you do have implants?
Yeah. So with implants, it depends the type, but it depends where the implants play. Sometimes it can be like under the breast tissue, sometimes it can be over.
Right.
So obviously if it's over the top, it's going to make it more difficult to feel lumps or bumps. But with this type of breast cancer, how it works is it causes inflammation that block the lymph drainage.
I can never say that. Spell it.
So your lymph nodes and your lymph glands and your lymphatic system is your body's way to get rid of infections. So they're little little sort of system that gets rid of inflammation. And if you think of it like a pipe, what happens is there's tiny little that you can't even see with the naked eye, little bits of tumour that get and block these little systems. So that's how the swelling starts, because that system's blocked. So then you get the swelling, and then you get the sort of changes and the swelling that starts off little, but the key thing is how quick it comes on. So it's within weeks. So some cancers, you might see that they're very slow growing. So you might have like prostate cancer. Some people that have prostate cancer can have it for years and not even know, and it'll take years for it to progress. But this cancer, it's grade 3.
Yeah.
So that means that usually the breast cancer cells can replicate every 10 days.
Gosh.
So it can double every 10 days.
Wow.
So it is quick. But going back to your question about implants, for inflammatory, because it's that skin change, actually they should be able to see it. So it should make a difference with the implant. It's only like the lumps and the bumps that it's going to be harder.
Right.
Wow, that's so interesting, isn't it? Like even today, like learning so many things, you think, why do I not know about this? Like, why? It's just amazing what you're doing with the charity as well. So tell us what kind of things IBC do to raise awareness or charity events, and then we can get on to what Tithead from Wigan is doing as well to raise money.
The charity's been founded and been around for about 10 years. So it was founded by a lady whose daughter who got diagnosed the same age that I did. So I got diagnosed at 32. And 10 years ago, she looked online and said that the death rates are horrific. So 10% of all breast cancers are IBC, because it's just whenever you get diagnosed, it's a faster rate, so it's quicker replicating, but also it's only ever at stage 3 or stage 4. So cancers can be stage 1, which is you've caught it really early, which is what we want, or 2. 3 is more advanced, and then 4 is usually when it's spread to other parts of the body. So unfortunately for IBC, it only can ever get diagnosed at stage 3, because it's already in the skin. So overall breast cancer rates and survival's doing really well, because we're finding them early because of the mammograms. People are checking. So that's why we bring awareness. But the founder of the charity saw that there was just no information in the UK about it. So there was a charity in America, and she was like, well, I'm going to do something about this. I think I need to get the word out there. So she set up the charity in the UK. So we support a lot of women with IBC on Facebook. There's a support group, and then we try and raise money. So we've got a researcher in Birmingham that raises money, that researches into what causes IBC, because we still don't actually know why. Why does your body suddenly decide to switch? So he's been doing research for years, but unfortunately, because we don't quite understand why this breast cancer works, and because of that, death rate is worse and it is more aggressive. A lot of clinical trials will exclude IBC women, because it will skew the results. And it's aggressive. So
Gosh.
We're not as far advanced in knowing about this type of breast cancer than compared to other ones. So yeah, that's what the charity do. So we're on all socials trying to raise awareness. We've got brilliant people that raise money for us every year. So yeah, that's what the charity does, to try and raise awareness, support women, and then try to put money back into and support research and awareness about inflammatory breast cancer.
Amazing.
Yeah,
amazing.
Totally amazing.
Just so needed. It's just...
Yeah.
I can't believe it's stage 3 when it gets diagnosed. That's what's blown my mind, is that...
And how quick.
Yeah.
How quick it can happen. I mean, that is super scary, because you'd think most women would go, you know, they find a lump, it may take them 2 or 3 weeks to get the courage to think, I'll keep checking, and then I'm going to go and speak to my GP. But if you've got this, and your courage to go to the GP has already took you 4 or 5 weeks down the line, how quick is that? That is scary.
So so literally you can have a scan the day before you start with the swelling and it will not show up.
Right.
So we've had a few women that have had normal mammograms and been reassured and been like, oh well, I've literally just had a mammogram, it's fine. But mammograms aren't brilliant at picking up inflammatory breast cancer. Me personally, I had an ultrasound about 2 weeks before I started with symptoms. Again, the ultrasound was normal. It was for another breast unrelated issue, but it was normal. So I was like, oh well, it's fine. Is it just because I've been examining, because I've had the ultrasound? It's sort of caused a bit of an infection, had a course of antibiotics. But from the day I started with symptoms to the day I saw a consultant in clinic, and then there was a bit of a lag with me getting sort of CT scans, the cancer was already had massively, it had taken over the whole of my breast.
Gosh.
So it was 13 centimetres. The whole of the breast was double in size, really heavy. It was into my lymph nodes under my arm, and it had actually gone into my lymph nodes under my breastbone as well.
Right.
If it had gone any further, it would have gone into my other breast, which would have been stage 4. So I got diagnosed at stage 3, but with the skin of my teeth, I think, really. And that's how quick. So I was surprised just how quick. I felt like I was quite proactive and quite quick. And I know a lot of other women, if they've had 2-3 courses of antibiotics thinking it was mastitis, it's just you're pushing it too much, really. So
gosh, bloody hell. So get checked. It's like and
so
checking.
I think we just want to know, kind of, for you, how was your journey mentally? You know, you've had this diagnosis. You didn't know about IBC then, so you've had this kind of like quick kind of fast-paced whoosh to your life. You know.
So I when I kind of knew. So I'm a GP by medical background. So I was surprised. I was like, I've got no family history of breast cancer. I was fit and well, running, had a normal BMI, alcohol within normal tolerances, didn't smoke. So all those risk factors for breast cancer, I didn't fit the bill, I didn't have them. And I literally had that ultrasound like 2 weeks before I started symptoms. So I was like, oh, it's an infection. But when I went to clinic and they scanned me and there was no infection, I was like, great. It's this type of breast cancer. I knew that I was like in for a rocky road. So it is hard, but I decided to flip it, and I knew that with this breast cancer as well, you have to have usually chemotherapy to shrink it before you have any surgery. Right. Again, that's a bit different from other breast cancers. So for me, being stage 3. I had to have chemo to shrink it, then the mastectomy, then radiotherapy, and then you have treatment afterwards. So I still had the chemotherapy hadn't quite mopped everything up. Right. I still had little micro mets in the lymph nodes. So I then had another 12 months of chemotherapy after that.
Such a long road, wasn't it?
Yeah.
Gosh.
Such a
So
long road.
I knew that I was in for at least, I knew about when I got diagnosed, I knew I'd have to have the chemo, mastectomy, radiotherapy, and they also advise you not really to have a reconstruction because you're going to have radiotherapy to try and blast all your skin that's been involved and all those lymph nodes that they can't get to. So because I had the lymph nodes underneath my breastbone, they had to make sure that those were radiated as well.
Good.
So try to minimise the risk. And I know there's a big women want to have reconstructions because it isn't nice to have a mastectomy and we're trying to, with breast cancer, people are having lumpectomies, so they're trying to have at least the amount of surgery is needed. But this type of breast cancer, it's just so aggressive that you need to have that treatment to be in the best chance of fighting it. And well, I don't like that word, but like trying to
kick its ass.
Kick its ass.
So having reconstruction, it's an additional major surgery. So some women do have it, but later on down the line, when your body's recovered, when you're fitter and well, and everything's settled down, because God forbid if you end up with an infection, because you can get swelling. It's quite common to get swelling after you've had a mastectomy. Some women end up with all the lymph nodes taken out their arm. They end up with a lymphedema, which is a big swollen arm, and they have to manage that.
I remember one of my friends actually. She used to have to crack her arm to move the lymph nodes or something, and she had to constantly just crack and she had to do it every day, and it was like, gosh, you don't realise how intense the treatment is, do you? And for your journey, that's a long road, isn't it?
So how I kind of cope with it, I was like, it's gonna be horrible, and the hardest thing was telling my family. It was heartbreaking.
Oh, bless you.
But it is like, who wants to tell the parents? Like,
no,
it's not nice.
Crap,
Is
it?
Yeah. So I'd been with my partner for 7 years.
Yeah.
We'd always been like, well, we're not getting married. What's the point? We've been together.
You're doing everything else. It's like a marriage.
I'm very practically minded. And I was like, why was I going to spend all the money on the wedding when I can spend it on a house? Like, I'll go on holidays. So we were like, actually, if I know that I'm going to be in for a rough ride, like, shall we just get married? Like, so we literally went off to York. He proposed. We went and like looked around York and got an engagement ring when we were there. And I organised my wedding in 6 weeks, which was just mental.
Gosh, that's
I had.
And we're family friends, so we know each other. And honestly,
so I was like,
it was
a whirlwind.
It was a whirlwind.
So I was like, literally, like, right, my sister, like, you can do the bridesmaids. Like, I got my family friend to do the photography. Like, I wrote in everyone who can do whatever.
And everyone were like,
yes.
doing this.
And they give everyone a job to do. And I think sometimes when you get diagnosed with cancer, the focus comes on you, and I'm even this, like, I'm like,
I know.
It's not good, is it?
No, I don't want to.
It's much easier talking about somebody else.
I know,
than
you don't want
helping.
to be.
Yeah.
I've always been like, even with work, like, I'm me. I'm not a doctor. I am a doctor when I'm at work, but I'm a person. I've got interests, and that's not what defines me. I'm me. So I think when you get diagnosed, and especially when you get diagnosed at a younger age, which IBC generally in breast cancer does get diagnosed younger, everyone's looking at you, and then everyone's like, right, we've got to what we're doing, and like my dad was like, come on, right, when's your scan? Right, can you not bring it forward? Like, I need to know now, like, and I'm like, yeah, but there's waiting lists, So so it definitely helped, and it was a lovely it was a lovely day, and I think it helped bring everyone together. And then the next challenge was I decided to, after radiotherapy, do the Yorkshire 3 Peaks as well. So
what is in your chemo?
I was still on chemo, so I was fine on the flat. not so good on the hills. So
like myself.
Yeah. So if anyone's heard of the Yorkshire Three Peaks,
Yeah.
you're meant to try and do it within 12 hours.
Yes.
So we did it by the skin of my teeth, but I literally got dragged around pretty much with.
Gosh.
I ended up having to take my bag off at the end.
Yeah.
Just because it was just a bit too tiring.
Yeah.
And I had the dogs pulling me up a little bit. So a bit
I
of
can't
dog
believe
power.
it. You know when you think, oh, what are you doing now?
Yeah. So.
But I get it. It's your mental. It's the mental
Focus.
strength, the focus. You've got to have something
Yeah,
other
that's
than
good.
this.
Yeah.
It's like transporting yourself away from constantly thinking about that, isn't it? Right, give yourself something positive.
Yeah.
Let's have a goal.
Yeah, and it's so
attitude.
Yeah, and it's so important when you get diagnosed with cancer and going through all that treatment is to keep yourself active. So
good.
you need to, because if you become inactive, then you end up with injuries and you're just in a lower physical, and it's good for your mental health as well, getting out. So I'm lucky that I've got a dog and a very supportive husband and family that have been brilliant and friends.
Yeah.
And now it's Paul's turn to kind of.
I know.
Yes.
I know.
So Lisa, tell us about Hubby and what is Tithead from Wigan doing to raise money for this charity?
Tithead from Wigan. Only I could have a Tithead from Wigan, isn't it? Oh wow. Do you know what? He's wanted to. We often give to charity, as most people, if they can, do. And this year, I think he wanted to push himself out of his comfort zone and actually do something and feel like he'd, rather than just say, right, we're going to donate, right, we're going to do something. Probably a midlife crisis, but so. Good one. He's wanted to raise £25,000. Well, his goal is to raise £25,000 this year, so in 2025. A number of events that he's going to do. So the first one is his cycle challenge. He's doing just short of 100 miles over 2 days, each day. So back to back. So just short of 100 on Thursday.
Crazy.
Just short. He's never been on a bike.
He's not.
It's just like, oh my God.
Yeah.
We've had such a fun journey getting all the little bits together. So even just buying the new shoes that clip into your pedals, I'm like, I need to video this when he falls off. But,
Has he fallen off yet?
well, he's not told me he has, but I don't know. He's just really, he's thrown himself into it. He really has. He's just unassuming, isn't he? He doesn't like to be in the limelight. He doesn't have social media.
No.
I think he has LinkedIn for work. That's it.
Yeah.
So even to get him onto social media and the courage to video himself is. Oh. But you know what keeps him going? He keeps saying, "When I'm tired, when I do this, then Ashley's had to do a lot worse." So I think that keeps him motivated then, so he gets on with it. So that's coming up really quick. 6 weeks time.
Yeah.
6 weeks time, and it's going to be here.
Where's he cycling from then in that 100 miles?
Yeah.
That's crazy.
So he's going from Blackpool. I think your hubby's been helping him kind of like recce.
Yeah, so the charity, hence why I'm wearing orange, is because it presents, as I said before, about the orange peel. So Blackpool FC, the Tangerines, so we're like, what a better place to start? And he's in the northwest, aren't we? We're trying to go through the northwest.
All the sports clubs is stopping off. So I think we've like incorporated Preston, Burnley, Blackburn, Liverpool. Yeah. He's obviously calling it Everton because he's a blooming Everton supporter. Oh. So we're calling it Everton. Yeah. And then I think he finishes at Bolton on day one.
Right.
Then I think he starts, doesn't he, again at Bolton?
Yeah.
And then again through some more sports, you know, even ladies' sports clubs, I think he's incorporated. Yeah. And he's finishing at Sale Sharks on the Friday. And Sale Sharks have been absolutely phenomenal. They've literally said, we'll do what you want. Yeah. And I think there's a guy called Steve there. His wife actually passed away from this. And we didn't know that when we contacted him. And he actually did, they were all doing podcasts, was it with Lady Dame Deborah that passed away with bowel cancer, and his wife, they were all friends. So literally, he's been amazing. They're giving us free rein, and we're doing it on their last day of the season. That's why we're finishing there. It's all kind of like tying in.
Yeah, it's match day, isn't
it?
So he has to get there. Yes. He's got a deadline. He has to make it.
God.
No pressure.
At least I had like dog power to lift me. I don't know whether he's going to be able to. He's not using an electric bike, is he?
No, he's not using an electric bike. No. So we've again, like you said, we've got loads of support from everybody, even
Yeah.
yourselves, you know, doing all these for us. We've got like
So
hubby
many.
your hubby doing.
Yeah, he's doing all the logistics and project managing and things like
And he's
that.
doing
yeah.
that, isn't he? We've
Yeah.
got somebody else doing, giving their time up for like doing an escort at the back.
Yeah.
Yeah.
Safety first.
Yeah.
Yeah.
And
Might
then,
need it.
yeah. The second challenge is he's been going to see a PT for about a year now. So is it
PT.
MGPT?
Yeah.
It's like
Martin
Martin
Garner,
Garner.
personal trainer.
and even
Yeah.
you go, don't
Oh,
you?
yeah.
There, and he's
He's
great,
amazing.
isn't he? He's amazing,
Amazing.
and he's such
Yeah.
good fun.
I think
Yeah.
I might need him.
Oh,
Yeah,
honestly.
yeah. Well,
He's such a good laugh, isn't he? He's a
Yeah.
banter, and
Yeah.
he gets you going. And do you know what? On a personal level, I've been going through a lot this last like 10 months, and he's been my therapist.
Yeah, he's a therapist.
He's really helped me. He's listened to me. He's guided me. He's kicked my ass at the gym and just kept me focused. Because you're right, it's that mental health side of it that actually, when you're going through something, no matter what we're going through, you need something to focus on and just motivate
Take
you,
you
don't
away
it?
from.
And he's just it's
He's
been
great.
fantastic.
So he's the next person that's giving up so much of his time. Obviously, he's gonna do. It's a 24-hour gym.
Yeah.
So it's going to be mimicked on a High Rocks
Yes,
kind of thing.
sort of
So
stuff like
we've
that.
he's
Yeah.
doing that.
Yeah. So is he doing like medicine
Yeah,
ball,
balls,
pole throws,
doing-
sleigh
Yeah,
pulling and
all of
stuff
that.
like that.
Gosh.
Oh.
So it's 24 hours.
Yeah.
And I think the aim is that they're going to get like teams of say 4 or 5, and it's just going to be rolling hours, so you do get a break. But
Yeah.
the actual event is going to be on for the full 24 hours.
Yeah.
So
We'll give it a go.
yeah, and he's going to give
Yeah.
he's going to give like training plans out to people that's going to join. So
Yeah.
you know, big shout out for Martin because
Yeah.
he's really stepped up there and helped us. And then the third one, I think, was it maybe yourself and Ali have come up with this, where to
Yeah.
like Pendle Orange.
Yeah.
Oh gosh.
Again, orange being the signature.
Yeah. So if anyone doesn't know, we're in the northwest, and Pendle Hill
Yeah, true.
is notorious for the witches. So it's a big-ish hill.
Yeah.
I won't say it's quite a mountain, but it's
somewhere in between.
Yeah, it's somewhere
Yeah.
in between. But it's a fair slog up there, and
Yeah.
I think it's going to be accessible for more people if we do. I think that's why we wanted to do it. And actually, again, it ties in with the orange theme as well,
Yeah.
doesn't it? And
Yeah.
everyone can get involved. I think.
And that's going to be more of a family event. So you
Yeah.
know, dogs, kids, granny,
Yeah.
granddad. We're going to have like different levels of the hill that we could, you know, is accessible for everyone. So if you're
Yeah.
not quite as fit, you know, you can kind of. We need people at the bottom as well as at the top. So
Yeah.
we're hoping that
Imagine
everybody.
that, like if we get to do it and everything lights up orange,
on that night.
it's just going to look amazing, isn't it? And like you say, anything
Yeah.
we can do to raise awareness for this amazing charity.
And we've got somebody
It's
with a
gonna be
drone as
fab,
well
innit?
who's going to like do all of that for us. So yeah,
I'm
everybody's
excited
happy
for
to
that.
give up the time for this. So
It's good.
a couple of little things, fun things. So I think our local pub are doing a kind of like a Santa-ish kind of pub walk
Yeah,
in December sometime.
we'll be up for that.
Yeah, everybody. Do you know what? That's the one challenge I'm going. Yeah, we'll do that.
Sign me up.
Pub, we'll do that.
Yeah. It's a shame we can't get like orange Santa suits. Now that'd be funny, but I
Yeah.
don't think that'd be quite easy to do, would it?
We'll see.
But yeah, we'll see
what we
what
can happen.
If anyone can help,
Yeah.
give us a shout.
Yeah. And then along the
Yeah.
way, do you know what's been really good is other people have said, I'm doing something this year. Do you know what? I didn't know what charity to donate to.
Yeah.
Whether it be £10, £20 or they've read whatever they've done. Like, so my son is doing a boxing challenge.
Yeah.
His company have already sponsored him £250 just for entering, and if he gets, I don't know, wins whatever, they're going to
Yeah.
double it, and he's going to
Wow.
get sponsors. So he's putting that money into it as well, into the 25 grand kind of goal.
Yeah.
So there's lots of people doing all other things.
Yeah.
So yeah, so that's kind of it in a nutshell. Tithead from Wigan, if you do see.
Yeah.
So where is he right now?
Oh, do you know what? Today, bless him, he's on his longest cycle ride. So he's left home this morning and is aiming to get to Settle in
Wow.
Yorkshire. So we're crossing the white roses with the red roses, or the red roses with the white
Yeah.
rose border, whatever it is.
Gosh, that's a trek then, isn't it?
Yeah.
So many miles does he think he might be doing today?
I think, well, it's about 30 there.
What?
Yeah, 30 or just over.
Oh
So
my
whether he
gosh.
decides to come back a bit, I'm taking the car just in case.
Yeah.
And meet him for a coffee.
Pub stop just to like
Yeah,
give him a bit.
yeah. And then see how he feels.
Wow.
But there's some. I think what he's wanting to do is get the hills in.
Yeah, and train for. He's putting so much on me training so far. It's
Yeah.
wow.
It might be all right at Blackpool, but it'll soon get hilly if he starts coming over towards the Pennines.
Yeah,
exactly.
So he needs to get
He
those
needs to
hills
get them
in.
hills in.
Yeah.
So so that's it. That's really.
Amazing.
Yeah,
amazing.
he's doing a good job, and I think, do you know what? Even for him, he's always busy.
Yeah.
This is a focus for him. Like we were talking about mental health.
Yeah.
And it's an odd word, that, because you expect somebody to be really poorly with mental health. It's not that a case. It's just training your brain to relax, to go somewhere else, think of something different.
Yeah.
And I think that's kind of what it's about.
Yeah, good on him. So
Yeah.
what I did, I asked like a few people like different questions because like me, they'd not heard of this type of breast cancer before, which again blows my mind. Like I've learnt so much today myself. It's just crazy. So we've already explained about what inflammatory breast cancer is and the signs and things like that. But what are the main signs? So the swelling, like mastitis, I think you said, didn't
so
you?
Mimics that.
Yeah, the main sign is the swelling,
Yeah.
the thickening of the skin, and it's the quickness. So it'll start off, and they say within 3 months, it's usually gone above a third of your breast.
Gosh.
So it's the quickness of it, and the skin changes, the colouring of it.
Mm.
But you should be aware of all breast changes. So if there's any changes with your nipple goes in, it starts discharging, you get any skin rashes, like not just redness, but any skin changes, and then of course lumps and bumps. And you should go see your GP.
Yeah, gosh, definitely.
I think this is a really good opportunity. This is for my entertainment factor. Take your top off, Emma.
Really?
Really.
Do you know what?
Do you know what? I think you need to take your top off.
God,
I
you
love
get me
this.
doing.
This is the only.
Right.
This is the reason I've come today.
Is it?
Come on, Emma. We need to see just where these swellings could be.
Right.
What,
Forgive
where?
my false tan.
Only Emma's false tan for this.
Have you
Yes.
still got your mic on?
I've got my mic here, so
yeah.
right.
Right.
What do I need to do to
Where does she need to
check?
put her
Where do I need
arms
to check? So I usually just check round the breasts. That's all I do. I don't, like you mentioned about armpits and stuff. What should we be doing? Tell me and I'll show you.
Yeah.
So first of all, the timing. So
Right.
if you don't check your breasts, then you're not going to know if there's any changes. So
No.
we want to check your breasts, but
Yeah.
what's a normal time period to check it? And I usually say once a month.
Right.
And then there's a lot on social media, a lot of breast cancer charities put posts up on the 1st. You don't have to do it on the 1st, but it's just that reminder, right, it's the
What
1st
day?
of the month, have a check my breasts, do it. Because we don't want you over-checking.
No.
So I don't want you checking your breasts every week, every
just like,
every day. You're going to end up with breast pain and problems.
Right.
And so once a month is ample time to check.
That's a good point. So if you are continuously checking, you
Yeah.
could bruise yourself, which then might bring on some symptoms
Yeah.
you think.
Yeah.
But actually it's because you've been messing around too much, isn't it?
Yeah.
Okay.
And then it's just being methodical. So there's
Yeah.
different ways of doing it. You can do it like an S shape.
Right. So it's
Over
not
your
just
breast.
so even
So-
over all of the breast. So it's not just the side you should be looking. It's actually over it.
Yeah, so the breast itself is obviously central, but the breast tissue goes up and under the arm, and then you can get lumps and bumps, so the lymph nodes.
Yeah.
Some people just notice that they've got a problem because they have a lump under their arm,
Right.
in their armpit.
So in your armpit you have to be checking. God, why don't I know this at
See,
44?
you know.
Why don't I know this?
Yeah. So there's different ways to do it. How I do it is
Yeah.
clockwise. So I start at the nipple.
Yeah.
And the best way of doing it is the 3 fingers.
Gosh.
So you're kind of rubbing in a circular motion.
Right.
Because in that way you're
Feeling all-
moving the skin
Yeah.
above, and then you're pressing it and you're moving it underneath. So if
Okay.
you start off at the nipple,
Yeah.
and then if you go, so if you've got little boobs, then it won't take you very long, but if you've got bigger ones, it'll take you a bit longer. And just, so you want to kind of just
Obviously
press.
with no bra on, but I'm
Yeah.
not going to do that for.
Yeah.
So kind of press in.
Press in
and
and then just
Oh, right.
rub
See,
it.
I'm still
So
not
press
doing it
in,
right, am I?
rub it
Rub it round.
rub it
Right.
round. So you go in and
still.
then you start off at the middle, you go right. So just take your time
And just
press,
go around the whole breast.
roll around the whole breast, all the way round. So
Yeah.
you pressing and rubbing each way,
Okay.
all the way round.
And even at the top up
Yeah,
here
and
as
just
well.
take.
And
Your, I'm doing it
things.
quite quick, but
Yeah.
just take your time, and then underneath.
And what's the
And then go under
significance
there as
of warm soapy water in the shower?
Oh,
So
yes,
yeah, the best
yeah.
way to do it, because if you're, as I said, you should be doing it when you're naked and when you're
Yeah.
naked in the shower. And
Yeah.
if you've got soap underneath, it makes your skin a bit slippier. So
Wow.
it
Yeah.
just makes it a bit easier to feel.
Yeah, so you're
lumps
not kind of like
Yeah.
jerky
Yeah.
movements and thinking,
Yeah.
oh yeah.
That's it.
Yeah. And then just having a look, as I said, look in front of the mirror. So when you before you put the bra on, just
Yeah.
actually look in front of a mirror and put your arms up above your head. Because as I
Okay.
said, you can see those
Underneath
your breasts
inflamed.
if there's any redness. Some people,
So it isn't right up.
especially in
Yeah.
the summer, you can get rashes under your breasts and things. And
Yeah.
I said, knowing what's normal for you, everyone's breasts will be different.
Yeah.
One boob might be bigger than the other.
Yeah.
I
Everyone's
think mine is
different.
actually, I've got a bit
I think we all are, aren't we? I
Yeah.
think is it.
Yeah.
Yeah, but I feel so embarrassed that I'm not
Yeah.
doing what I should be doing,
Yeah.
or just the awareness. It's just
Yeah.
you see it all over social media, but actually, I didn't know that's the best way to do it with 3 fingers, or when you just get out of a shower,
Yeah.
soapy water. So a great top tip: under your armpit, in your armpit.
Yeah, so
Yeah.
again, like making sure that you kind of lift
Oh gosh,
underneath,
right, okay.
deep down
Yeah.
at the side. So you think of it like 4 walls.
Right.
So
Yeah.
do the 4
Oh
walls.
my gosh, right, okay.
So that's how the best way to do it. So again, 3 fingers, and then
all
you're
the way
feeling
around.
it all the way around.
Must get my t-shirt back on now. So.
And do you know what? It's not.
Thank
It's
you.
as well as it's about checking for yourself. Because we've just had this conversation, and women are really good at talking.
Yeah.
If somebody come and chatted to you, Emma, and said, "Do you know what? I feel a bit," and you'd go,
Yeah.
"Can you just check for this? Because now you know."
Yes.
You're gonna.
Do
You're gonna
that. Only I could do that. I even checked as well. Oh,
But
God,
you're helping somebody else, aren't you?
Yeah, and there's
that's
not.
important.
Yeah, and there's not an age like you have mammograms and they start around 50, but actually you should be checking your breasts much younger. I was diagnosed at 32, so
Yeah.
you should be knowing. And Copperfield do a brilliant job, so they're
Yes.
a charity, and they sort of encourage people at uni and those age that you shouldn't be waiting until you're older to start checking your breasts.
Yeah.
No.
You're more likely to have benign, which are like non-cancerous breast problems, like nothing to worry about when you're younger. And your breasts do change as well. So when you're under 30, they're firmer.
Yeah.
And when you get older, they're a bit fatter and saggier.
That makes you feel better now.
Yeah, and they change in your your
Yeah.
monthly cycle as well.
Yeah.
So it's knowing what's normal for you, and things potentially will change when you get older, and at the time of the month. But there shouldn't be an age change, or like I said, men can get breast cancer as well. So
Yes.
it's knowing men as well need to be checking and be
They
aware
check
of
similar
changes
as well, obviously. but-
Yeah, and like other halves as well. So if you're in bed, like your other half, like
Yeah.
if they know, they should be aware of things.
True.
And be like,
That's good
actually
to know.
that looks a bit different, and
Yeah.
they should be aware of because sometimes, as I said, people aren't brilliant always are going to see the doctor. So
Yeah.
sometimes you need that encouragement of another
Yeah.
half to be like, that doesn't look quite right. Come on, have you been
Yeah.
checked out yet? And
Yeah.
They did that on Emmerdale actually. I love Emmerdale. Love it. I'm a geek when it comes to Emmerdale. But the doctor actually did notice it on his partner, Chaz, and she was then diagnosed with breast cancer after a night together. And I think that's a really good point. It's actually everybody should know about symptoms, lumps and bumps, and what to look out for,
Yeah.
because then that could lead to getting, checked sooner and
And
things
with
like
this being
that.
so aggressive,
Yeah.
there's no luxury of time, is there? There's no luxury of
No,
time. You need
yeah.
to be, if you notice something and you think, that's odd, I
Yeah.
now have this in my mind,
Yeah.
get yourself to the GP straight away, isn't it?
I think it's that knowing about mastitis. Like my sister had that after with breastfeeding, and it's horrendous sort of pain and things,
Yeah.
isn't it, as
Yeah.
well? And you can very easily link it to an infection and get fobbed off and
Yeah.
think, oh, it's just that. But actually, you know, yes, it can be that, but also be very mindful that if it's not going and things like that, to just go back and
Yeah,
just,
definitely.
you
Yeah,
know, look.
if the antibiotics aren't working, it's getting worse rather than better, you need to come back and see.
Yeah, definitely.
Yeah.
What is the risk of like reoccurrence and things for this type of cancer? Because you hear it how other people are at risk of it reoccurring. How is it with this condition?
So, like I said at the beginning, it only gets diagnosed at stage 3 or stage 4. So, with about 2/3 will be stage 3 and 1/3 will be stage 4. So stage 4 will have treatment then lifelong. We do have some women that have been on treatment for 10 years plus, so they're doing well.
Yeah.
And the treatment is dependent on, so the breast cancer itself will have, like other breast cancers, different hormones. So you might have heard of estrogen receptor positive, progesterone receptor, HER2, and so the reoccurrence rate is dependent on the individual tissue type of the inflammatory breast cancer. So it is more aggressive and it's more likely to reoccur. So if you are stage 3, the reoccurrence rate is much higher compared to other breast cancers, just because of the aggressiveness of it at diagnosis.
Gosh.
Yeah. Everybody needs to be aware.
Oh, absolutely. Well, thank you to you guys for sharing so much. I, again, embarrassed at the age of 44 that there's so much I didn't know about, but I do now, and I will be sharing this with everybody because it's just so important, isn't it? And like you say, the orange peels sort of skin, how your skin can change. I didn't know that.
Yeah, so we know that like it's a lot of I think M&S and other sort of bigger retailers, they have in the change rooms and the back of toilets, they have the signs to look out for breast cancer. But now you know that that's swelling. Think of the orange cancer, think of IBC when you're seeing and thinking about checking for your breast.
Yeah,
that's what we want to be, for you to be aware of.
That's a really good point.
Yeah.
So just thank you to you guys.
Yeah,
And also Paul as well. So I'm going to see a lot more of him on social media. So watch out for Tithead for Wigan.
Give us a like, give us a share. We need it to just go and as wide as we can.
Yeah.
We need that money for the research for this awful disease.
Yeah.
The research is not as good as the money for other types of breast cancer, is it? You know, it's there.
Yeah.
You need it. We need it. We need it. So that's why we need to get as much money in as we can. Come on,
Paul.
Come on, Paul. You can do it.
Thanks, guys.
Yeah, thank you.